How to use the Formulary review suite. Did you know that CMS provides review tools that issuers and states can use to prepare for the QHP application process? These review tools allow you to check for errors within your QHP application that would result in corrections after submission. Issuers are encouraged to use these tools to identify and correct data errors prior to submitting application data in order to reduce the number of required corrections identified during CMS's reviews. States are encouraged to use these tools during their reviews to identify potential errors in their issuers' application data that would require issuers to make corrections. The Formulary Review Suite runs two different non-discrimination reviews, primarily based on data from the prescription drug template. These two reviews include the Non-Discrimination Formulary Outlier Review and the Non-Discrimination Clinical Appropriateness Review. The Formulary Outlier Review identifies and flags as outliers those plans that have unusually large numbers of drugs subject to prior authorization and/or step therapy requirements in 27 United States pharmacopoeia classes compared to other plans in the state. The Clinical Appropriateness Review analyzes the availability of covered drugs to ensure that issuers are offering a sufficient type and number of drugs in accordance with clinical guidelines for certain medical conditions. The review also checks to see whether certain drugs used in first-line treatment are available without prior authorization or step therapy. To use the Formulary Review Suite, you must have a populated prescription drug template. However, for the tool to work most effectively, you're highly encouraged to use a populated master review tool with data from the Plans and Benefits template. While use of the master review tool is not required, it allows the Formulary Review Suite to remove any drug lists included in the prescription drug template that are not associated with a plan. With the master review tool data imported, you will also see review results at the plan level, not just the formulary or drug list level. To download the Formulary Review Suite, visit the Review Tools webpage of the QHP certification website and click on the Automated Review Tools link. A zip file will be downloaded to your computer. Within this zip file, you'll see several of the standalone review tools, including the Formulary Review Suite. There will also be a folder labeled FRS Reference Files. Open this folder to find the Formulary Review Suite instructions. Read these instructions carefully before using the tool. Once you read the instructions, open the tool in Excel and enable macros. Also read the Instructions tab carefully before beginning. Step 2 asks if you have separate individual and shop prescription drug templates. If you or your issuer submit data through the System for Electronic Rate and Form Filings, or SIRF, and have separate templates for individual and small business health options program or shop market plans, select Yes. Otherwise, leave the selection as No. If you selected Yes, be sure to follow the template naming convention described in Step 2. In Step 3, select the state being reviewed using the drop-down menu under State Selection. In Step 4, you have the option to import a master review tool to pull in plans and benefits data into the Formulary Review Suite. Again, it's highly recommended you use a master review tool when running the Formulary Review Suite. If you do wish to complete this step, click on the Import Data from Master Review Tool button. In Step 5, indicate whether you wish to run both the Formulary Outlier Review and the Clinical Appropriateness Review at the same time or separately. Then click the Run Formulary Review Suite button. A series of dialog boxes will appear, asking questions surrounding the thresholds you want to use for each review. Read and answer each question carefully. If you need clarification on any of these questions, please refer to the instructions documents you read before opening the tool. Note that the Formulary Outlier Review uses data from all issuers in a state to run, and will not return meaningful review results for a single issuer. However, issuers may still find it useful to run the tool in order to see which categories and classes are included, and drug counts for each one. After you complete the threshold questions, select the folder in which the prescription drug templates can be found. Running the tool could take several minutes, depending on how much data is processing. The tool will populate several tabs that provide more detail on the Formulary Review Suite review results. If there are any data errors, an Errors tab will generate, identifying and describing the error. On the Output Description tab, you will find a more detailed explanation of the two reviews the tool runs, an overview of the corresponding tabs, and descriptions of additional supplementary tabs. The Formulary Outlier Summary and Clinical Summary tabs give summaries of each review. The top row of each tab will show the review results. If you see all lists met, then the data imported passes both reviews. If, however, either tab shows that there were plans or lists that did not meet the requirements, use the corresponding Summary and Detail tabs to further identify the error and where the issuer will need to make corrections in order to pass each review. The Formulary Review Suite will populate an Issuer Summary tab. If you imported data from the Master Review tool, you will also see a Plan Summary tab. These tabs will display review results at the issuer and plan level. If you imported data from the Master Review tool and any not met review results were received, the Plan Details tab will appear. This Detail tab will more directly identify the exact errors a plan receives, as well as detailed messaging to help you better understand why a plan has been identified as deficient and what steps you can take to correct the error. Issuers should review the errors for necessary corrections, update the relevant templates, and save and validate them. If any changes are made to the Plans and Benefits template, be sure to re-import the new Plans and Benefits template into the Master Review tool. Then re-import any corrected data into the Formulary Review Suite and repeat the review process until all plans and lists meet the requirements. Be sure to use the instructions documents you read before opening the tool for any further clarifications on rerunning the tool. Now let's review examples of possible corrections you may receive and how issuers can resolve them. During the Formulary Outlier review, you might receive a correction if a plan has too few drugs without prior authorization or step therapy in any USP categories and classes under review. This correction will be outlined in the Formulary Outlier Summary and the Formulary Outlier Details tabs. To address this correction, issuers may modify their prescription drug template to remove prior authorization and step therapy requirements from the identified list of drugs, or add drugs without restriction to the deficient category or class. Issuers may also provide a justification. Issuers submitting justifications should be sure to submit appropriate justifications and supporting documents for the relevant review. Use the combined prescription drug supporting documentation and justification form to respond to corrections. Provide clinical support and/or evidence to justify a drug list's design. And explain why the correction occurs and how it is not discriminatory. During the clinical appropriateness review, you might receive a correction if a plan does not cover enough drugs in any class to treat a specific condition under review. This correction will be outlined in the Clinical Summary and the Clinical Details tabs. Issuers can also use the All RxQEs Submitted tab to see an overview of RxQEs included in the Formulary Outlier and Clinical Appropriateness reviews that may or may not be covered on an issuer's prescription drug template. For each issuer and drug list, this tab identifies whether the drug is covered, the tier the drug is on, and the restriction status of each drug. Note that the RxQEs shown here are examples, and may not reflect the RxQEs included in the Formulary Outlier and Clinical Appropriateness reviews for the upcoming plan year. To address this correction, issuers may choose to cover the missing drug or drugs in the identified class by modifying their prescription drug template, or provide a justification with supporting clinical guidelines identifying the reasons why the correction occurs and how it is not discriminatory. If issuers choose to submit justifications, they should again make sure to submit appropriate justifications and supporting documents for the relevant review. Use the combined prescription drug supporting documentation and justification form to respond to corrections. Provide clinical support and/or evidence to justify a drug list's design. And cite clinical guidelines to assist with justification submissions. If you have questions regarding the QHP application review tools, please contact the Marketplace Service Desk at cms_feps@cms.hhs.gov or 855-CMS-1515. For more information about the QHP certification process, visit www.qhpcertification.cms.gov.